Hi everyone, and welcome to Attendant Healthcare Solutions webinar. Today we're going to be presenting a special webinar on the NextGen Patient Portal for bulk messaging. First, I'd like to mention that this webinar will be recorded. We'll be sending out a copy of the slides along with the recording within the next week. Next, for those of you who have attended our educational webinars in the past, you'll notice that this one's a little bit different. This is purposeful as we've been putting thought into how to best help you help your patients during this COVID-19 crisis, and we believe that short webinars on relevant information may be the best way. So with that in mind, this will be a short webinar and we'll leave time for questions at the end. Okay, so back to today's webinar on bulk messaging in the patient portal. At the end of the presentation, we'll open the floor up to questions from you. We'll take all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Solutions at Itentiv. Cindy Kincaid is Vice President of Consulting Solutions, and Lexi DeMarche is Manager of Consultant Development. So Lexi, I'll go ahead and pass it off to you.
Okay, thank you, Chelsea. So thank you everyone for taking time out of your hectic schedules to join us for this brief webinar. Communicating with patients during the COVID-19 crisis with NextGen Patient Portal bulk messaging. So we wanted to put together this webinar because we understand that, as the CDC and government recommendations, the information regarding the COVID-19 crisis, it's constantly evolving, and so is your practice. So your practice has had to, quickly adapt to ensure the health and safety, of not only your staff, but also your patients. So with all of these changes, mass communication really is the key to ensure that your patient population stays informed. So most, if not all of you, are probably dealing with reduced staff, and they might also have additional duties as a result of this crisis. So that means they don't have the bandwidth, to call or message each of those patients individually. So one solution that can be found within NextGen is Patient Portal bulk messaging. So this can be used to communicate, things like your practice's new policies or maybe recommendations, and we know those can change day by day. So this is an efficient tool that can help you to effectively keep your patients in the know. So as some of you may not be familiar with, so possibly the reason you joined this webinar today, already built into Patient Portal messaging is the ability to send bulk messages to a group of recipients. So these messages can be sent to patients that either have a pending or completed enrollment status. Those recipients for these messages, you can select them individually, or probably a more common way is to use NextGen reporting. You even have the ability to include your own NextGen users, so maybe example your providers, just so that way they can be kept in the loop on this messaging as well. So one of the convenient ways that you can select a group of patients to send a message to is through reporting. One thing to keep in mind, I want to make sure I note, is that this feature only allows you to select enterprise EHR reports. So just keep that in mind when you're thinking of how to use this for your practice. So in our patient portal window, if a user clicks on the To button, they're going to see a drop-down with several options. So the first option is to add report. So that's going to allow you to generate a list of recipients, and that's going to come from any enterprise EHR memorized report. If you don't already have a memorized report that's created that's going to capture the list of the patients that you need, you can also select the report filter option. So this is going to allow you to customize a one-time report. It's going to pull exactly the list of patients that you need. A useful filter that I recommend if you're going to be using this when you're creating a report is found on the Patient tab. There's a checkbox there that says Enable Patient Portal Status. So when you select that checkbox, then you can go in and choose the specific statuses that you want to include. So for example, you only want to send this message out to patients that have an enrollment status of pending and completed. So you can kind of filter the list that way. There's also additional filters that are going to allow you to narrow down, so you're only getting the list of those targeted patients. So for example, let's say you want to send a message to your higher risk patients. So for example, those with diabetes, to give them additional instructions during this time. So this can be done through that report filter. In that example, you would select a diagnosis of diabetes. So once you've ran your report and your list has been compiled, you'll see, as we see in our screenshot, that 2-line will now display report results. And in parentheses, you'll see the number of patients included. So if you want to go through that list and just kind of verify which patients were actually returned from the report, you can click on that where it says report results. And you can see here this patient set is going to show you a list of all the patients included that will receive this message. So there are several options in Patient Portal messaging, and that's just going to allow you to customize the bulk messages that you're sending out. So one of these options is the ability to mark messages as high priority. So if you're sending out really important updates, it can be beneficial to make sure that this message stands out for patients and that it doesn't get lost in the list of all their portal inbox messages. So a Patient Portal message, it can be marked as high priority in that first screenshot we see on the Patient Portal message window, and then also in that second screenshot on the Properties tab as well. So another option for Patient Portal messages is delayed delivery. So with delayed delivery, you can actually create messages now and schedule them to be delivered at a later date and time. So this can allow your practice, just an example, maybe you want to compose a series of educational messages related to COVID-19. You'll maybe include different resources and things like that. You have the ability to create all those messages now, and then you would actually schedule them and they can be released, for example, maybe throughout the week or, in the coming weeks, things like that. So in order to set up a delayed delivery, you go to the Properties tab on our Patient Portal message window, and you're going to select the checkbox for delayed delivery. From there, you have a few options. You can either select from those drop-downs, so any of those default values. So you could say, in the next 2 days, 1 week, things like that. Or you can also go down to that second box there, and you can actually just manually type in a date and time. So you can really customize these to be sent, whenever you think it's going to be most beneficial for your patients to receive it. Any messages that are set up for delayed delivery are able to be viewed and modified at a later date. So if you want to go in and change those delivery date or the message, or even delete the message to stop it from being sent, you can find those in the scheduled folder. And so that's going to be on our Patient Portal tab of our inbox. We'll see that under the Communications section. In addition to delayed delivery, you also have the option to enable a read receipt. So that's going to help you just confirm that patients have actually opened and viewed this Patient Portal message. So this is also configured on our Properties tab. You can turn on those read receipts, and then there's even a preference there that you can check off that will set that as a preference for all meetings, or all messages going forward. We understand if you're sending out mass communications, probably to a large number of patients, you may not want the read receipt from every single patient. We don't want to inundate your staff with those messages. So another option with these read receipts is the option to select a notification if a patient has not read the message within a certain number of hours. So, let's say, for example, you're communicating new office policies as a result of COVID-19. Maybe you're requesting patients don't bring their children to their appointment. You may want to put a read receipt in this example for like 48 hours, and then that will just allow your staff to follow up with those patients individually. So I'm sure that a lot of practices have been seeing an increase in calls from patients. They probably have questions or maybe concerns during this crisis. So if you're sending out a mass communication, you may not want to have another place the staff has to check by allowing patients to reply to that message with any follow-up questions. So one solution to this is to turn on the Do Not Reply feature for your bulk message. So here we can see on the Properties tab, you can check off at the bottom, I do not want patients to reply to this message. So that's just going to, prevent any reply messages, and you can then direct your patients to your preferred avenue for questions. So, for example, if you'd rather have them call the office, you can include that in the message and not allow them to reply to this bulk message. So when we're sending out these bulk messages to a large group of patients, you may not want to have one of your own staff's name associated with the message, not just one individual user. This is a message coming from your practice as a whole. Maybe when you're communicating, for example, new office policies, you want to include your practice name or maybe even a specific department, maybe scheduling or something like that. So you can actually do this in the patient portal with called Patient Portal Online Profiles. So these profiles actually allow you to create an alias and then assign specific users, and they can actually send and receive replies under that generic name instead of having their own personal name associated with those messages. So these online profiles are created in file maintenance. They are in an online profile system master file. So you can set these up, and then, like I said, you can assign users. In addition to assigning users to that alias on this screen, you also have the option to check off "Do not allow patients to reply," and that's going to apply to any messages sent under this alias. So again, just to kind of slow down, hopefully, the number of messages your staff is having to sort through. So to use an online profile when you're actually creating messages, a user that has been given access in that system master file can select from that the From button on our Patient Portal message window. And from that drop-down, they're going to see a list of all of the online profiles they have access to. This alias can be used, so in composing messages like we see here, we can use them when they're replying to messages and also when they're forwarding messages. So any responses to a message from a patient will be received by all users within the online profile. So these messages, they're going to function just like our typical distribution list. So, they'll have the ability to accept messages, by an individual user. They can mark messages as complete, things like that. So the alias functions a lot like our distribution list. And so we're just hoping with the ability to customize and send these bulk messages through reports, hopefully your practice can find a way to utilize NextGen Patient Portal so you can really communicate with your patients during this COVID-19 crisis. Okay, so now I'm going to turn it over to Cindy, and she can give you a little description of what we're looking at going forward.
Okay, well, I just want to touch base. Before we move on, I also want to give you another hint of some things that are going on that we've been receiving bulletins. We don't have any specifics, but as many of you are moving to a remote solution with your team members, please caution them about emails that they're receiving. Hackers and the bad guys, we all know they're out there, they're very good, and they know that there are a lot of people working on systems that maybe aren't as secure as those in your office. So they're really looking to exploit those weaknesses. So just really emphasize to everyone to please, please be careful with any attachments or anything that they open. Again, we're just general warnings. We don't have specifics. If we have specifics, we will schedule a webinar much like we did this one. In addition, we are temporarily suspending our scheduled webinars for educational purposes. There may be other webinars that you get from us, but for the educational ones we had about upgrades and those type of things, we're suspending those because I don't think those are on your mind at this time. So we want to just focus on giving you information and tools that might help you through this crisis. So we're all moving through these uncharted waters together. And I know it's a very hard time. We're going to do everything we can to give you innovative ways to use NextGen as a tool to help you in your practice during this COVID-19 crisis. So keep an eye out for our webinars. We're looking at some now. I think we will have one coming up, hopefully even as early as Tuesday of next week, an invitation. So just looking at some different things as to what might be things you never explored. these are all things that are here, they're there, but maybe you just never had a need to use them. And now we're looking at all sorts of new opportunities to help get us through this. So I'm going to turn it over to questions now. And thank you all for joining us.
Okay, perfect. Thank you, Cindy, and thank you, Lexi, for the material. Again, if you have questions, you can type them in the questions area of the webinar control panel, and we'll just go through them in the order that we've received them. We haven't received too many of them, so likely if you have a question, we'll be able to answer it. First question, do you have any solutions for electronic signatures when the patient is not in the clinic?
No. I don't know. What we use is if you send something to them. Actually, I shouldn't have said no so quickly. I'm going to give you some things. First of all, as you know, a lot of things for communications with patients have been relaxed a little bit from CMS. Again, as long as you're acting in good faith. So before I take that out, there are some things that you might be able to do using Adobe. Now, that might be really pretty difficult for the patient, but you can do electronic signatures. Lindsay, I know you're on the line right now. Would you take that as a research option for me to see if the patient can just say acknowledge via some type of communication that they've signed it? I don't know if there's anything new on that. There's nothing technically within NextGen that accommodates that if they're not in the office. I can tell you that today. However, maybe we'll look at some innovative ideas that you can use some of the Microsoft tools to do that, or maybe just a communication that the patient acknowledges it.
Yeah, I think, Cindy, just to jump in here, I mean, not really solution-wise, I think what we've been doing, honestly, with some of our, we have a new intern program starting, and that will be completely virtual, and things that they need to sign. Adobe has that functionality, and even Chelsea, you can probably speak to this. You use this.
I use it all the time.
Yeah, we've also had people be able to actually print out documentation, sign it physically, and then actually secure email back, or maybe portal message back to you a copy of the signed document just by taking a photo on their phone. There are a lot of different options, I think. Versus
I think it's more in terms of the patient population that I can tell you right now, my parents would not have a clue about any of that.
Yeah.
So those are the type of things. So I'm just, those are good ideas, and that's what we do, and it's great ideas. So I think it's going to vary from the patient. I'm just wondering if it could be something like they could. I don't know. Let's just think that through. I mean, we've got all your email addresses on the webinar. If we come up with anything other than what we've suggested, we'll certainly send that out. But it's not. I don't know that it's as easy as that.
Okay, thanks. Next question, and it looks like this might be our last. So again, if you have a question, feel free to type it in. Is it easy to send all active patients at once? In the past, you couldn't do so easily as bulk portal messaging.
Yeah, so there are different filters. So as far as all active patients, you should be able to do that. And then as far as my recommendation would be just to go to that patient tab that I mentioned, and you can filter by the different statuses. But yeah, you shouldn't have any problems doing that with those report filters. If you have any specific issues or anything like that, again, we'll have our emails. You can reach out, but yes, you should be able to do that.
I see the other one from Donna about not sure
Yep.
about the HIPAA rules as far as sending a picture through your phone. That's correct. Okay, they've only relaxed the rules as it relates to the virtual visits associated with COVID-19. So I think all of you have seen that, and we're getting some documentation on that. I think that was just an example of things that we could do and things that we're doing right now. But for your patients, there probably would be no reason for them to send a picture. So thank you for that clarification.
Okay, thank you, Cindy, and thank you, Diana. Next question. Can you send a bulk message based on date of appointment or appointment type?
So the way to send bulk messages through reporting is all through EHR reports. So unfortunately, there's not really a lot of options as far as actual like a list of appointments or like patients with upcoming appointments. Yeah, I definitely understand the benefits of that. So you would, a suggestion, you could go in and individually add patients, or if you could find a different EHR report that would satisfy your needs. But no, as of now, there's no option to select based on appointment.
Okay, thank you, Lexi. Can we send a link to individual patients via the portal to connect to Zoom for a phone visit?
No. I don't know if any of you have explored Auto through your NextGen account executive. Auto is, I know that some of you are looking at a very temporary location. We have completed, so here's what we're doing very quickly. We presented Auto to the clients that some of you know, we are a reseller, so we can sell to our clients, but you also have your NextGen account executives who have the same capabilities we do. So if you have a question about Auto or the NextGen virtual visits, you can reach out to them. If you've already made a decision on Zoom, we have completed literally this morning, because several of our clients, we've got some women's health and people who may down the line not want to use, this is an emergency type of situation. So we created some very simple documentation for the patient and the provider on Zoom that might help them, but there's no way to integrate Zoom into NextGen, so that any of the functionality you would get in the virtual visit would be there. So that's a disappointment, but there's no way to do that, to my knowledge, and we've looked at it.
Okay, thank you, Cindy. Next question. Can you show slide number 3 again after patient portal recipient reports?
Very quickly, let me jump back to the Zoom HIPAA. You are correct, but CMS, we've got documentation, so we need to get that out if you haven't seen it. That's off the table for telehealth visits right now. That is off the table during COVID-19. They have relaxed it as long as you are acting in good faith. Okay, so that's a correct statement, and once this crisis is over, I'm sure all of those things will go back, but they're no longer penalizing through order of the president that you can do your telehealth during this crisis. So the HIPAA rules, everybody needs, if you're not aware of that, please go out and research. And I don't know if it would be easy, Chelsea, to send the fact sheet about that, Lindsay,
Yeah,
Lindsay created.
I can actually send the link right now in response to that question if you want to see it. There's an announcement, and Zoom is actually listed by the HHS as an option just right now during the public health emergency, where they've relaxed and decided to waive any HIPAA penalties as long as you're acting in good faith.
Yeah, but this only is, I don't want anybody to think that they have just, HIPAA's gone. It's not. It's only as it relates to these visits, because they're trying to keep people off the street, including patients. And if patients can stay out of the practices safely, they're doing everything they possibly can.
And there'll be more information as well if you get our weekly newsletters. There's an entire article and resources listed on that'll be coming out on Monday.
So we have a number of people requesting that article. Lindsay, would you be able to send that to me, and I can include it with the slides and recording when I send that out to everyone?
Yep, absolutely.
Okay, so we'll send that out to everybody. Thanks for the requests for it.
Yeah, this is a moving target. I mean, there are more things coming out every single day with codes, in terms of how to code, what to do. We aren't coders. We're not here to tell you that, but we're just working really, really hard to make sure we stay on top of it with our consultants and everybody associated with this.
Okay, so Lexi, could you flip back to slide 3 after patient portal recipient reports?
Sure. Oops. Sorry, I'm looking at the numbers and they were not accurate. So I'm thinking is there a question specifically about priority levels?
And they haven't, nope, looks like they're good. They just wanted to see it.
Okay.
Okay,
Perfect.
Another question. I ran my report and I have duplicate patients. Any way to eliminate that?
It would need to take a look at the filters that are being used and see what the reason is for that. I would say maybe just double check your filters, and then if you're still having issues, if you wanted to follow up, you can. I would say my recommendation would be just to ensure that maybe you have a filter that's not giving you the correct. Okay, so multiple practice. So a follow-up statement was that you have multiple practices with the same patient. So yeah, you can filter by enterprise, but potentially you could set up a memorized report that allows you, if you can find a specific report that Okay, grouping doesn't work. That was going to be my next suggestion. Yeah, there's really, unfortunately, with the EHR reports, there's not as many filters as I'm sure you're aware as there are on the PM side as far as grouping by location and practices and things like that. So I can see if I can do some more research on that and get back to you.
Well, and then also,
solutions
for all of you that are out there, this is standard NextGen functionality, and they are aware of it. So, some of those things you can also log tickets. Log a ticket with Success Community. So, Lexi, please see what you can find, and then maybe even explore a deeper option with reaching out to Success Community through your normal channels. We really wanted to make everybody aware of this, but we will certainly see what we can find. Oh, never mind. Donna said they can get 2 emails. Well, maybe that'll work, because then perhaps with any luck they'll actually read one of them.
Yeah.
And it looks like we had somebody else jumped in and said, can you reread the person's question on the Zoom link? I think they're wanting to send to one patient, and then they can probably copy and paste the Zoom link. Just thinking on this and trying to help. Cindy, you want to weigh in?
You could probably, I don't know how these messages work, if you can, because of the fact of NextGen being secure, but it's coming from the portal, I don't know if you can put links in your messages. Lexi, do you know?
Yeah, I know. So, because as I'm sure if you're aware with Zoom, you have the ability to just copy the whole message that includes that link. I don't know that the link would be functional just because it is through a patient portal message, but I can't think of any reason why they wouldn't be able.
Well, the documentation that we created. So let me dig into this a little bit deeper, and then we're probably. Can you send it? And I don't remember, and I should.
Cindy?
Can you send attachments?
Cindy, somebody said that you cannot. That they're using links and they have to email the patient.
Okay. So what we were
thank you,
thinking
Kim,
here,
for weighing in on that.
Yeah, that's what I was thinking. So what we've got, so thank you for bringing that in. The documentation that we created, what we created was for some of our groups that are actually have decided upon Zoom, and it's the one we recommend because it seems the easiest for patients to navigate. So what we did is we created a document that just instructs the provider to get his account set up, because many of the providers don't have this and they're all new, and we did it based on the free Zoom. So we wanted to let you know about that. And then we created a document that you can send to your patient. And do those documents, were we able to get the links in those documents, Lexi?
So yes, there's a link to the Zoom training. Is that what you're referring to?
Yes. In the documents we created that you just sent me this morning. Do the links in that work?
The links to the training.
So if we share that, then that might be a tool they want to use. Now, someone else says no, you cannot, but then someone says you can send links, but there's a format tool you have to use to make it clickable. So all of those things are items that you can explore. Again, now that you've got it out there, we just wanted to make you aware of the tool, but it might be something useful, Lexi, to know. So maybe you can dig into that and we can get back to everyone on that question.
Okay. Well, it looks like that's all the questions.
So why don't we, as a result, when we're sending this out, we'll send out the information so that you can find out, so that you can explore the link that we're sending from Lindsay, and then also we will send out this. Let's go ahead and send the Zoom documentation, and if it's useful, great. If not, it's of no need. It's just something we're putting together internally to make sure that we're responding as quickly as we can. And then we'll dig into the link issue, because that would be really nice.
Okay, perfect. And the last chime in that I'm going to read before we close for the day is somebody else chimed in on the Zoom thing and said it's easier for their practice to email, user-friendly. We have 10 licenses just for this. So thank you everybody for your help and for chiming in. This is a time that everybody helping each other is awesome. So thank you all for weighing in and for helping.
And as we find other things, we will continue to share them. So keep an eye out for the webinars. Some may be useful, some not, but we're going to continue to try.
Yep, and like I said, we'll send out a link to the recording, and then those 2 things that we just discussed, we'll send those out in a couple of days here as soon as we get the information. So thank you everybody for joining us. Stay safe, stay healthy. Thank you all so much for doing what you do and serving your patients every day and in this extra hard time. Truly, you inspire us every day. So thank you.
Yes, definitely. Have a great and safe day.